Hello, and welcome back to the second topic of ethical considerations of data on demand, the ethics of data collection. In this second video, I want to talk about different methods of data collection. So with that said, let's go ahead and start with a definition of data collection. Data collection is the process of gathering and measuring information on variables of interest in an established systematic fashion that enables one to answer stated research questions, test hypotheses, and evaluate outcomes. So in thinking of this definition, we also can consider methods of data collection. So we're often want to gather information, and there's definitely several ways that we can do this. So in the health sector, there are many ways that we can collect data. These include surveys, so questionnaires or surveys that are used in human subject research. We have clinical forms, so data collection instruments used to collect patient information. We also have our electronic health records. So this may be where our demographic information is held, including things like doctor's notes, medical history, diagnoses, lab results. And often this collected data will be used as evidence for some sort of treatment by a clinician. Next, we have public health surveillance. So compared to surveys in clinical forums, where you're often working with an individual, public health surveillance is actually on the community level. So this is the collection of information about the health and behaviors of communities, and often this will guide public health interventions. And another example includes clinical trials, which will test the efficacy of certain medicines, therapeutics, as well as medical devices. And lastly, we have patient or subject interviews. So these are one-on-one or focus group interviews that will use some sort of qualitative research method and often do something like coding those interviews. So with that said, there are many other ways that we can collect data in healthcare, and I just wanted to mention a few more. So we have things like genomic sequencing. So this is large-scale collection of genetic information. We also have health and community surveys and medical devices. So these are things that we'll be wearing on our physical body that will constantly collect data. And we also have things like mobile health apps, where, say, a patient is actually putting in information through an app and data collection happens that way. In addition, we have things like medical imaging as well as microscopy. So just, we have medical imaging, medical devices, surveys, genomic sequencing, as well as all of the other examples that I mentioned. So with that said, we do have all of this within our health sector, but as librarians, we do our own data collection. So we have things like patron data. So this could be things like circulation requests, foot traffic, other types of sort of the comings and goings of patrons within our library space. And often this will be used for things like evaluation, reporting, and quality assurance. Next, we have our collections metadata. So this is data and metadata related to our library holdings. A lot of times we will be teaching in libraries and we will be giving students an evaluation form. So things like post-workshop evaluations that will help us determine the effectiveness of library education. In addition, we have things like education statistics, so the number of participants registering or attending our library educational opportunities. And that said, LIS professionals and information professionals are often researchers that will come up with their own research questions and collect data that way. And this can include many different types or sort of approaches to the research process, but will often include some type of data collection analysis, as well as things like research, writing, and publishing. In addition, we have interviews and observations. So we can certainly do interviews with our stakeholders or even our faculty members on how they use the library. And we can do things like observation, so documenting interactions in library spaces. So these are just a few forms of data collection that you may encounter in library settings. So what is done with all this collected data? There are a lot of things, including things like policy decisions. So data that is collected and analyzed, maybe that will inform a policy and that policy will be put into place in your community. We also have source allocation, so funding prioritization. So if we think about where clinics are going to be built, if there's going to be food assistance or infrastructure or other services within our community, often the argument for those being built are data-driven. We talked a little bit about public health interventions and public health surveillance, and often that will be used for things like public health interventions. So this will be at the population level, recommendations from people like the CDC. In addition, we have research and publications. So collected data that is analyzed and has some demonstrable findings. Often that will be published in a discipline-specific publication, and ideally that data will be made available. But more to the point, often the findings that we find from our data are published. In addition, we have things like secondary research. So existing data certainly can be reused by others. So that's where we get into the sort of components of data sharing and reuse. And collected data could also just be simply a jumping off point for future research. So the collection of additional variables, the expansion of research questions and hypotheses, it can just really kind of give us a groundwork to explore other avenues. With that said, that means that a lot of things happen with data that is collected. And we need to sort of have an ethical framework or think ethically when we talk about data collection and think about data collection. And a helpful framing comes from Data Feminism by Catherine Ignazio and Lauren Klein. Especially chapter 4, they discuss several things. And in thinking about data collection and those methods, we can also think about what is present and not present in that data. So this idea of what gets counted counts. And as we saw in the last slide, what is counted often becomes the basis for decision making. So if you're not included in that data, maybe you become invisible when it comes to the actions that are taken or sort of the decisions that are made with collected data. And something like this can really reinforce things like health inequities. And in subsequent videos, we will be talking about what health inequities are. That said, data collection can be positive, especially if we're using an ethical framework. It can also be empowering. So that really gets to the idea of data for good or data for social change. So I do want you to take a few minutes and think about the idea of what gets counted counts. What other topics or communities do you think are often obscured from the data collection process? Okay, hopefully you're able to think critically and identify some topics or communities that are obscured from data collection and the implications of that sort of erasure. So in closing, please keep in mind that data is contextual. Even with what is collected or thinking about what is collected, often that is very narrow compared to someone's full lived experience. It should always be contextualized with other factors, and what is collected can be limited by things like researchers' interest, funding, and outreach. All right, so up next, we'll be talking about some case studies that I think will be useful when we start thinking about the ethics of data collection, and we'll be talking about some additional ethical frameworks for you to consider.